Hello, ladies and gentlemen. Welcome to the first introductory session of ECG Essentials. I'm your humble host, Prince, and as I said, you can call me Princo. I want us to begin our session today with a very interesting and heavy question. And the question is the simple lap dab of the heart, the simple lap dab of the heart, is it comparable to the subtle complexity of a Beethoven string quartet? Again, is the simple lap dab of the heart comparable to the multiplying tonalities and polyrhythms of Stravinsky's Rite of Spring? Lastly, let me ask if the simple lap dab of the heart is comparable to the extraordinary jazz interplay of Kijari's Standards Trio. Ladies and gentlemen, I don't think so. I don't know much about music, but I think music will always win this debate, and I hope I get to convince us all during our discussions beginning now. Our focus today will be to establish the electrical and the cellular basis of electrocardiography, the cellular as well as the electrical processes that underlie electrocardiography. And on that topic, the very first statement we want to make is that the heart has an inherent electrical activity, an innate electrical activity. And it is the heart relies actually on this innate electrical activity to perform its function. And the ECG actually, as we know it, is basically a recording or a tracing of this electrical activity of the heart. For that matter, when there is any perturbation at all in the normal flow of this electrical activity we have mentioned, the ECG recording likewise deviates from the normal, that is expected normal. And it is on that basis that clinicians are able to diagnose a host of clinical cardiac conditions, non-cardiac conditions, etc. And it's also on this same understanding that Dr. Wilhelm Einthoven and all the other scientists that preceded him and that also worked after him, it was on this understanding that they have developed this electrocardiography as a diagnostic tool that we use now. I believe it's imperative for us to appreciate the basis of this electrical activity that is inherent within the heart. And to be able to discuss that well, we need to do a brief review of some physiological anatomy of the heart. And we begin that by stating that functionally there are three main groups of cells in the heart, three main types of cells in the heart. The first group of interest is the pacemaker cells. The second group of cells is the electrical conducting cells. And the third group of cells is the myocardial cells. That is the myocardial cells proper. The first group, that's the pacemaker cells, can be likened to the powerhouse or the electrical power source of the heart, that is under normal circumstances. And as an analogy, those of us in Ghana, Akosombo VRA services, that is like a chief power source for the country. So that's like an analogy what the pacemaker cells represent in the heart. The second group of cells essentially represent the hard wiring of the heart. That's the electrical conducting cells. They represent the hard wiring of the heart. And in Ghana, again, my country, the Princo and the extensive electrical wiring all the way into our homes is a good analogy for the electrical conducting cells. That's the hard wiring of the heart. The large group of cells that actually form the vast majority of the heart tissue is the myocardial cells proper. And this group represents the contractile apparatus or the contractile machinery of the heart. And if you want again, as an example, they would have been like the appliances that are benefiting from this electricity that has been conducted all the way from Akosombo through the channels, the wire wiring into our homes. These cells that we have mentioned, ladies and gentlemen, these cells are polarized, electrically polarized in their resting state. In the resting state of these cardiac cells, they are electrically polarized. And as we recall, all it means to be electrically polarized is that the inside of the cell is relatively negative as compared to the outside. The internal environment of the cell is relatively negative as opposed to its external environment. And I'm sure we all remember that the cell membranes of cardiac cells, the cell membranes of these cardiac cells that is of interest today, they are endowed with so many voltage-gated ion channels and then special ion pumps, that ensure that certain important ions are distributed in their necessary proportions, and it's actually the movement of these important ions through these channels that ensure that when the cell is in the resting state, inside is more negative as compared to its outside. Key amongst these ions that we are talking about are potassium, sodium, calcium, and chloride. Potassium, sodium, calcium, and chloride. This relative negativity that exists during the resting state of the cell is quickly lost, and in essence it's important that it's actually lost so that the heart will function. And the process through which this resting polarity of the cell is lost, as we all know, is depolarization. And depolarization occurs when positively charged ions cross into the inside of the cell, of course through these channels that we have aforementioned, reducing the normal negativity, that is the normal relative negativity of the inside of the cell. This process of depolarization is a key contributor to the electrical events that occur in the heart. And within pacemaker cells, the process occurs spontaneously. It's important to state that in pacemaker cells, the process of depolarization occurs spontaneously. The depolarization that occurs in a pacemaker cell is propagated through ion gaps to adjacent cells, in a fashioned order. And this whole propagation produces a wave of depolarization that is transmitted then across the entire heart. This wave of depolarization represents a flow of electricity, in other words, represents an electrical current that can be detected by electrodes when they are placed on the surface of the body. Exactly what we do when we are recording an ECG. Closely following depolarization is repolarization, another familiar term. And as the name gives it away, is that process that reverses whatever happened during the process of depolarization, thereby restoring the cardiac cell back to its normal resting polarity. So whatever ions that were either influx or efflux during the process of depolarization are actively pumped back in their necessary proportions by these same ion pumps that we have mentioned to ensure that the resting polarity of the cell is restored. And it's important that this happens, of course, so that the cell can go back to the resting state so that it can be depolarized again to ensure that function. Because the process of repolarization, also involves the movement of ions, it also leads to the generation of electrical currents, and this same electricity can be picked up by electrodes that are placed on the surface of the body. And of course, what we do, and then the through which we generate the tracings on an ECG. Ladies and gentlemen, we have intentionally avoided the very details, that's the nitty-gritties of the action potential of a typical action potential of a cardiac cell, in terms of all the phases that are involved, at which point sodium is influx, at which point calcium comes in, and then potassium. No, we are intentionally avoiding that. Again, we have intentionally skipped the very detail of how a cardiac action potential of a cardiac cell may vary or varies from the action potential of any other cell of the body. And we have done this intentionally because we promised that we were only going to do a brief review of physiological anatomy of the heart. But all that we have been interested in establishing at a point is the fact that two key processes underlie the electrical activity of the heart, and these two processes are depolarization and repolarization. And the basis of these processes is the flow of certain vital ions across important channels in the cell membranes. And due to the flow of this electricity from the process of depolarization and repolarization, electrodes placed on the surface of the body can pick this electricity and then produce waves that we use as the electrocardiography. Still with our physiological anatomy brief review, I want us to revisit the three types of cells that we mentioned earlier. That is the three main groups of cells that constitutes the heart, i.e. the pacemaker cells, the electrical conducting cells, and then the myocardial cells. I think it's important that we look at them in a little more detail because several pathological processes affecting these individual groups of cells, of course, will have interesting manifestations in the ECG. And also it's important we look at them again so that we find out how much each of them may even contribute to the generation of the waves of the ECG itself. So the first group of cells that we mentioned are the pacemaker cells, and we said that they represent the electrical power source of the heart. And these cells have, as we have said earlier, they have the ability to depolarize spontaneously over and over and over again. The rate of depolarization, that is the rate at which these cells depolarize, is determined inherently by these cells. They have it within themselves, the inherent characteristic to depolarize spontaneously, as we have said. But again, the rate is influenced by some external factors, like for instance neurohormonal input, like when there is a sympathetic surge that leads to a release in catecholamines. Of course, this rate of depolarization may be expected to increase. Each spontaneous depolarization, right, that in essence represents an action potential, is a source of a wave of depolarization that initiates one complete cycle of cardiac contraction and cardiac relaxation. Amongst these pacemaker cells, the dominant group of pacemaker cells is called the sinoatrial node, which we are all very familiar with, the SA node. And this SA node is located in the right atrium. Because we are trying to avoid any detail, we wouldn't want to discuss the whole cresta terminalis as being the actual site of this SA node, or even to discuss, that is more located towards where the superior vena cava makes its entrance in the right atrium. Some of these details we are trying to avoid, but we just want to state that the SA node is located in the right atrium, and it is the dominant group of pacemaker cells in the heart. This group of cells typically fire at a rate of 60 to 100 times a minute. 60 to 100 times a minute. But it's important to put across that this rate may tremendously vary depending on the autonomic input at play at a particular point. So that if there is a vagal input, for instance, we expect that there will be a depression in the rate, and the opposite is true. If there is a sympathetic surge, we may expect that the epinephrine or epinephrine will lead to an increase in the rates at which they fire. Ladies and gentlemen, although we have mentioned that it is these pacemaker cells that reserve or that have the ability to spontaneously depolarize, it suffices to mention that each cell in the heart actually has an automatic ability to behave like a pacemaker cell. Each cell in the heart has an automatic ability to behave like a pacemaker cell. But it is the SA node that is most efficient at performing this function, and so will maintain this function, of course, till it fails due to any reason at all, or maybe something in the internal or the external environment of the other cells of the heart, that's besides the SA node, stimulates the automatic behavior of those other cells. For example, a heart disease or a sympathetic stimulation may cause some of these automaticity. Having looked at the pacemaker cells, the powerhouse or the source of power, let's look at the electrical conducting cells that represent the heart wiring, or in other words, the electrical highway of the heart. And everything still starts from the SA node. And from this SA node, we have specialized cells, that's the electrical conducting cells, which are arranged as internodal tracts in the substance of the right atrium. So the anterior, middle, posterior internodal tracts all arrive at the atrioventricular node. And we all know that there is a brief pause for special reasons. We'll revisit the detail later. But beyond that brief pause in the AV node, the impulse will continue further. But the impulse will still cross from the right atrium into the left atrium through the Bachmann's bundle. The Bachmann's bundle will conduct the electrical impulse from the right atrium to the left atrium. So then beyond the atrioventricular node, the impulse goes towards the bundle of His, which almost immediately branches into the right, and the left bundle branches. And we know that the right bundle branch makes its way towards the apex of the right ventricle. But then the left bundle branch behaves a little more intricately, just a little more sophisticated, and so divides further into several fascicles. One goes into the septum, so we have into the interventricular septum. So we have a septal fascicle, then the posterior and anterior fascicles that go towards the left ventricle. Beyond the terminal portion of these bundle branches now branch, that is ramify into more like tiny twigs into the substance of the ventricles, that is through which the electrical impulse will arrive at the myocardial cells proper to ensure their contraction. So in brief, this is more like the electrical conducting system, where we find the specialized cells called the electrical conducting cells at play. The large group of cells, the myocardial cells proper, which represent in a sense the contractile machinery of the heart. These cells, as we have said, they constitute the vast majority of the heart's tissues, and they are basically responsible for contraction and relaxation to ensure that the heart delivers blood as it should. I'm sure we all recall that calcium is very important when we are discussing cardiac cell contraction. And when this electrical impulse has arrived at a myocardial cell, it basically leads to a release in intracellular calcium. So because of the increase in the intracellular calcium, several processes occur that eventually lead to the contraction of these cells. We will not want to discuss the whole detail of excitation coupling, the whole interplay between the actin myosin filament, not the whole detail of physiology, but just to put across the fact that calcium is released when the impulse of the electrical current arrives at these cells, and the increase in the calcium in the cytosol now underlies the eventual contraction of the cell through several processes that occur within the cardiac cell. Although we have stated that the key function of these myocardial cells is the contraction and relaxation, these cells can actually transmit, and in fact actually transmit electrical currents, but they do this not as efficiently as the conducting cells will do. As such, a wave of depolarization arriving in the myocardium will rather spread slowly through the entire myocardium. Ladies and gentlemen, the other important point to state here, having looked at these individual groups of cells again, is that the waves on an ECG primarily reflect the electrical activity of the myocardial cells, which of course form the vast majority of the heart tissue. The waves on the ECG primarily reflect the electrical activity of the myocardial cells. The pacemaker cells, the conducting cells, they do not generate enough voltage to be recorded by the surface electrodes that are used during an ECG recording. If you have survived all through without dozing or sleeping, then I must say I congratulate you. I must say you have done so well, because this actually is like the most boring part of the whole study of ECG. So thank you so much for your audience. We have basically tried, in summary, to establish again the cellular and electrical basis of electrocardiography. And in doing that, our first statement was that the heart has an innate biological electrical activity that enables it to perform its function, and that the ECG is essentially a recording of this electrical activity, so that if there is any disruption or perturbation in the normal flow of this electrical activity, we expect that there will be changes in the expected waves on the ECG as well, and that is what enables us to make our diagnosis. We also mentioned that the basis of the electrical activity of the heart is the movement of some important ions, i.e. potassium, calcium, sodium, sometimes chloride. And then we say that these ions move across special channels and voltage-gated ion channels, and sometimes ion pumps. And then they are distributed in their necessary proportions to ensure that two key processes occur. One, depolarization, and two, repolarization. And we said that it is these two processes of depolarization, repolarization, that lead to that generation of electrical current that is picked up by electrodes that are placed on the surface of the body during the recording of electrocardiography. Next week, God willing, I can't wait to come your way again with our next introductory session. And I promise you that should be more interesting. We will seek to discuss the ECG paper, like all those lines that we see. What do they represent? What do they mean? We also want to discuss concepts like the duration, the voltage, what a wave is, what a complex is, what a segment is. We also want to then introduce the individual waves that we see on the ECG, how they all come about and what they represent. Interesting times ahead, ladies and gentlemen. So see you soon. Kindly tell a friend, a colleague, our medical students, please let other students get to know of it. Let's all revise and study the subject of ECG together. See you again soon. Bye-bye.